I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of Holistic Integration, where lives are changed every day through the natural approach to healthcare. Where we're going to talk about holistic heart. We need to be focusing on our health right now. Very important. A lot going on in the world.
Very important.
It's very important to keep our health up.
Yes. A tremendous number of people are coming in with high stress. Mm-hmm. These are stressful times. Mm-hmm. And what are you going to do about it?
Right. Because
the stress will actually make you more susceptible to heart disease, cancer, and even infection. So, being aware of that and taking the necessary types of steps to help along those lines is very important.
So let's talk about the heart. What is holistic heart?
Holistic heart is a division of our office where we're concentrating on cardiovascular disease. Now, we're not just concentrating on cardiovascular disease in the traditional sense, though that's a very important part of it. It reflects our whole model. Our top tier, what our basis is, holistic integration. So holistic integration has the holistic part, which is the structure function. Homeostasis is the basis of structure function, which is the balance and the healing and the improvement of health in the body. And we look at the body in a very holistic type of way. Yeah. Integration is where we are then connecting to the medical model that is presently dominant in the United States and getting the best of both worlds. Our philosophy is 80% of all treatment should be structure function based, 20% disease care based, which is pharmaceuticals and surgery. So with that, we know that we'll get the best outcomes. Mm-hmm. So with the heart, with cardiovascular system, that is one of the major areas. So we have space along those lines now that we are concentrating solely on that to help us to get the best of both worlds.
Mm-hmm. So what is the philosophy behind holistic heart?
Well, holistic heart, we are in transition in the whole cardiovascular system on how we're actually treating it. Mm-hmm. Even medically, there's a big shakeup that's going on. So we want to be on the forefront of the new way of approaching cardiovascular disease, as well as all different types of diseases. But cardiovascular disease, of course, is our number one killer, mm-hmm. and something that we now really need to concentrate on. And with that, we are getting behind that and seeing how these changes can actually take place and become a standard part of cardiovascular disease elimination.
Mm. So how common is cardiovascular disease?
Well, cardiovascular disease is the number one cause of death in the United States. Mm. One person dies every 36 seconds from cardiovascular disease.
In the United States?
In the United States.
Every 36 seconds?
Every 36 seconds, someone dies,
wow.
Which is a lot more than with the COVID. Mm-hmm. So 655,000 people die from cardiovascular disease a year, and it accounts actually for 1 in 4 deaths. Matter of fact, one of the biggest things that was occurring was a lot of the COVID-19 deaths were actually people who were in stage of cardiovascular disease. Mm. And those people had a much higher mortality rate having the COVID-19 and really accounted for a lot of the deaths that were counted towards COVID-19 were people who were probably going to die anyway from cardiovascular disease. The COVID-19 could have sped it up a little bit. Mm-hmm. But this is something that is a major underlying problem. And if we didn't have the major problem of the cardiovascular disease, far few people would have died from the COVID-19.
Right.
So this is a major, the number one health concern in America is this.
So what diagnostics do you do for cardiovascular disease?
Of course, we do all the standard types of tests. So all the different types of things that you could possibly do with the heart. Of course, the gold standard is the echo, which is something that we have done on our patients. So we do all the standards, but we then also do quite a few different types of things that most cardiologists don't do. Mm-hmm. So we look at hair analysis because the minerals play such a big role. We're much more thorough on looking at all the different types of blood tests that could be done. We also do a nutri-eval where we can break down on the deficiencies in the body and actually know what's going on because, truthfully, 80% of the problems with the heart are really nutritionally based. Where there are deficiencies that are going on that leads to the heart having the problems that they're experiencing. When you're talking about the heart, how much work is done on that, the average heart is about the size of an adult fist. The heart beats 115,000 times a day.
Wow, 115,000.
115,000 times a day. And it pumps out 200 gallons of blood a day. So, when you're talking about it's a working. And you can see where if things aren't optimally, that you're going to start to have some heart problems. So looking at it as, our old faithful, it doesn't get a whole lot of attention along those lines, but it is something that we all know that we absolutely need. And there's only one of them. And, we don't have a backup in there.
Right.
So how we take care of that heart is very, very important.
So what has research shown about the common treatments for cardiovascular disease?
Well, one of the biggest things that was a huge part of treating cardiovascular disease is the surgical method. And that's what stents, bypasses are kind of the standard type of area. And the National Institute of Health did a very, very thorough study over that over 5 years to find out how effective and how much of a change it makes to have the stents and the surgeries actually done. And their conclusion was not so much. It really doesn't make a whole lot of difference. The only difference that it makes is if it's an emergency. So emergency surgery is very, very beneficial, which is one of the things that we look at, is that we find that really where disease care shines through is in the emergencies. So if you're having a heart attack, I would prefer you to go to the emergency room, not to my office.
Right.
Because they actually do a much better job. However, if you're talking about long-term health of the heart, structure function care does the best. So the old model and insurance companies are really looking at that, whether they should be paying for those anymore. And that really the idea of the surgeries at this point is one of the biggest money makers for hospitals. So there's a lot of pushback from it. But the research that the National Institute of Health actually did was pretty clear cut that the results on that were zero.
Okay. Interesting. When we come back, more on Holistic Heart. We'll be right back. Holistic Integration is excited to announce the launch of our very own dietary and herbal supplement line, Stasis Supplements. Stasis Supplements are created to maximize our patients' experience of true health by bringing mind, body, and spirit back into alignment. Learn more about Stasis Supplements on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip featuring rapid release technology. Yeah, we're going to talk about this rapid release technology, or RRT. It's our secret weapon, like to say. It's non-surgical, drug-free treatment option.
Sure.
It's FDA registered high-speed vibration device. It was developed in 2010.
Actually by a chiropractor.
It's a pioneered high-speed vibration therapy. It's focused on the relief of soft tissue problems affecting nerves, muscles, tendons, and ligaments.
There's a lot of different ways that you can get adhesions and scar tissue and different things released. A lot of it can actually be very painful to achieve. And it's one of the things that is not well treated at all in the disease care model up until this point. What they were able to do is come up with a concept of a vibrational instead of a mechanical. It's vibrating at a frequency that they found breaks up tissue that is abnormal. So it actually starts to change it, melt it away. When it does that, then it allows the body to go in there and lay down normal tissue that is fully functioning. The good illustration on that is an opera singer who can sing, and you've got that fine crystal starts to vibrate. and it vibrates at a higher frequency, even to the point where it can even crack. What you're doing with this rapid release is you're creating a vibration, and that doesn't harm normal tissue. As a matter of fact, it actually heals it, gets more circulation and makes it better functioning. But abnormal tissue, it actually breaks up and then it helps the body to dissipate it.
Relax muscles and release aches, pains, and tension through Rapid Release's high-speed vibration therapy. Experience the benefits of rapid release therapy by scheduling an appointment at Holistic Integration. And to purchase your own, go to our website at thevoiceofhealthradio.com. Click on the Rapid Release banner and enter code Prather, Prather, for a $100 discount for the Voice of Health Radio listeners. Holistic Integration is proud to offer CBD products from Jace Clinical Solutions. There are tens of thousands of studies showing the benefits of CBD products. There is evidence showing CBD can help insomnia and improve both falling asleep and staying asleep. Studies show that CBD can be helpful for addictions by alleviating cravings for alcohol, opioids, stimulants, and cannabis. CBD has also shown promise for chronic pain patients. CBD has also shown great success with various forms of anxiety and has shown promising results with inflammation as well. Many of the CBD products you can purchase are simply not regulated like those from Jace Clinical Solutions. That's why we offer their CBD to our own patients at Holistic Integration. Go to thevoiceofhealthradio.com, click on the banner for Jace Clinical Solutions CBD, and enter the code Prather, Prather, to receive a 25% discount and learn more about how Jace Clinical Solutions CBD products can benefit you. Cardiac issues are not only the leading cause of death in the United States, but the entire world. If you'd like to learn more about a heart health program that goes beyond just drugs or surgery, then join us for Holistic Integration's free open house event on Wednesday, February 22nd at 6 p.m. At this Holistic Integration open house event, you'll hear from Dr. Robert Prather, host of the Voice of Health Radio. You'll learn about our holistic heart program that is designed to give our patients safe, non-invasive, and medically sound cardiac care. We offer an individually tailored program that is more than just stents and statins. Healthy refreshments will be provided. Those who attend will receive a free autonomic nervous system test that measures your nervous and circulatory systems. The Holistic Integration Open House event featuring Dr. Robert Prather, Wednesday, February 22nd at 6 p.m. RSVP for this free event by calling us at 317-848-8048 or register online at thevoiceofhealthradio.com. You're listening to The Voice of Health with Dr. Robert Prather of Holistic Integration, the most comprehensive wellness center in the Midwest. Well, we're talking today about the heart, Holistic Heart, a program we have at Holistic Integration. And you made a strong statement before we went to break about
bypass surgery and stents. And I actually didn't make that statement. Mm-hmm. I'm quoting that there was no difference. And what they were saying is that it's not that you ignore it, but that medication actually has as much benefit with really no changes having stents and bypass surgery on the longevity or incidence of the cardiovascular disease from there.
Okay.
And that was, I was actually very surprised about that. Because I thought that there would be some definite benefit.
And this was information?
National Institute of Health.
Okay.
From the research that they did.
I just want to clarify that. Let's talk about the ECP and how it can help with cardiovascular disease.
External CounterPulsation therapy. That's something that's been around for 60 years. It was developed by Harvard Medical University. And there for a while, every cardiologist in the United States had one. Because what they were finding was that this really, the whole thing is if you look at the information on treating, what is the scientific information on what works on treating the heart? Mm-hmm. They have quite a few different medications that are very effective. It is now found that most of the surgeries aren't as effective that they thought they were. Mm-hmm. The medications, there's quite a few for different types of conditions, but the one thing that makes the biggest difference on cardiovascular health is aerobic exercise. If you take every single condition of the cardiovascular system and you say, what is the common factor that makes the biggest difference on heart health? It's aerobic exercise. So that is the big panacea for this problem. And one of the main issues that we have with America today, why it's the number one killer, is because people aren't doing aerobic exercise on a regular basis.
Right.
But when you get someone in congestive heart failure, a lot of the people who we sit there and say, you need to do aerobic exercise, they say, Doc, I can't walk up the stairs.
Right.
How am I going to do aerobic exercise? So Harvard Medical University came up with a device, external counterpulsation, where you get the same effects as doing aerobic exercise. Matter of fact, all the benefits except weight loss for the cardiovascular system with this machine, and the machine actually does it for you. So the big thing that they say is that you get the benefit of 5 years of marathon training in 7 weeks doing ECP.
Wow.
So it's pretty dramatic.
So what was your inspiration for starting ECP in your office?
Well, I had a patient who came in and he was having cardiovascular disease, and I could see that he was just really getting to a point. So I called around all the cardiologists and said, and I had some friends who are cardiologists, and said, I need this patient to get on ECP. I know that you have a unit. And at that time, all of them did. None of the cardiologists do now. And he said, I can't. And I said, no, this guy is willing to pay for it. You don't have to go through insurance, but he needs ECP, otherwise he's going to die. He said, I agree with you, but I can't do it because the ECP has been classified as a structure-function device. Now, how you become a structure-function device is that if the only way that you can be classified as a disease care procedure or product is if you have negative results that are associated with it. So if it doesn't cause death and disease, then it can't be classified as a disease care. It can only be classified as a structure function. And he says, I am not classified as a structure function doctor. So I therefore cannot do this procedure anymore. He said, and you are a structure function doctor. You do it if you want it done. And so I started the process, made sure that that was something I could do, and got that on board so that I could start to fulfill my calling as a structure function doctor and provide that for the patient. Unfortunately, it was too late for this patient. This patient had already died by the time that it came in, which was heart-rending because everybody loved this guy. He was just someone who was just amazing. And seeing someone die along those lines and not having that was something that I really felt that I needed to change and start to implement that in the office. And that's also why we started Holistic Heart, is because this is the number one killer. And I think that really the thing that can turn this around, where we can actually get probably an 80 to 85% improvement cardiovascular outcomes, is by implementing structure function care also into the heart care system.
Well, let's talk about different treatments, structure function treatments also for cardiovascular. How important are minerals in your treatment for cardiovascular issues?
Absolutely critical. The great cardiologists already know, and if you look at the textbooks, balancing out the minerals is one of the most important things because, again, the heart is beating so often. It's the mineral pathways on there that allow the muscles to actually work. If those minerals get out of balance, then you actually get abnormal heart rhythms. So one of the quickest ways that you can improve function of the heart is to balance out the minerals and get the minerals to where they need to be so the heart has the tools to be able to work correctly.
And we check minerals through a hair analysis.
Hair analysis and blood tests. The combination of the two really gives us the picture that we need.
So why is magnesium so important to heart health?
Well, an example of that is I had a patient who was under quite a bit of stress, and his wife insisted that he come into the office and get checked out because there had been 3 people in his company, which was going bankrupt, who had died from a heart attack. She just had a feeling that he would probably be next. So as we did his blood work, the lab actually called me with an emergency and said, hey, you need to get a hold of this guy now. I said, why? Because his magnesium was so low that he was going to fall over dead then. I said, well, how soon do we need to get him on the magnesium? They said, now. So have him go to a health food store and buy all the magnesiums there and start taking them now. So we called him, got him up there, made sure that the magnesium balanced out. But the number one, you hear about these guys who are out on the golf course in their 50s. Tennis courts. Fall over dead, and they had a sudden heart attack. Well, what happened was that they had been stressed out because men, when they're stressed, burn up magnesium. And if the magnesium gets too low, then they're going to have a spasm of one of the arteries. They're going to have a heart attack, fall over dead. Now, for women, it's usually potassium. So when women get stressed, they actually get low on potassium. When the potassium goes low, that's when a woman will fall over dead from a heart attack. So looking at those numbers and being aware. Matter of fact, if you're really good at it, you can actually look at an EKG and look at it and say, this person is low on potassium, this person is low on magnesium, this person is off on their calcium levels, because it shows up so much in that electrical current that goes on with the heart with the different changes in the minerals. So minerals are absolutely critical to avoid those types of situations.
So magnesium for men, potassium for women
are the main things, but there can be imbalances in the calcium, in the sodium levels. All those different types of things play a very big role in cardiovascular health and have to be looked at very carefully. And one of the things is that is not something that cardiologists normally do.
Right.
So this is why, we're combining the structure function care with the disease care model. And again, it's an integration because in those emergency situations, the disease care model really shines through. And there are many times that this patient needs to be on a beta blocker to actually get things under control. So there are definite times that the pharmaceuticals are necessary and do quite a bit in handling cardiovascular health.
All right. When we come back, more on holistic heart. Listen to the Voice of Health radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
The low-carb bread, have you tasted it? It looks like bread, but it has no other properties of bread. I went to taste it, and my brain sent a signal to my mouth. Get it out! Get it out! It tasted like the wrapper was still on it. And I said, you know what? I'll put butter on it. Butter wouldn't go on. I would put the pad on and it would fall off. Jam and jelly would beat up and fall off. Did they Scotch guard this at the factory? I tried to toast it. It wouldn't toast. I'm out in the garage with a blowtorch. It's absorbing the heat like a space shuttle tile. How does this break down in my system if it doesn't toast? They're gonna dig me up in 5,000 years and go, he was on the no carb. See that disc?
The Voice of Health Wellness Tip featuring Jace Clinical Solutions, the most trusted CBD brand. Dr. Prather, why did you choose to carry Jace Clinical Solutions products?
I didn't want to jump in, just pick any CBD
Right,
product.
it took you a while.
Right.
You were looking for the perfect CBD.
Sure. The big thing is that I didn't want any THC in there, which is actually a very big problem. And I noticed that a lot of them were being shipped over to China to be made, which is never a good sign. Many of the different products, as we were having them checked out, a lot of them actually had THC in them, which we didn't want to do.
Would they say that they had?
No. Some of them had absolutely no CBD in it. There were all sorts of heavy metals, pesticides, chemicals in there. The products were entirely unregulated, and I was not liking anything that I was seeing. I've seen very big promotions going on, even at doctors' conferences, and the products were garbage. Then I got to talk to the Jace Clinical, and I actually knew the gentleman before and knew of his integrity. And he had actually taken his time trying to put it together so that he did it right. The products are checked on a regular basis to make sure that there isn't any chemicals, pesticides, heavy metals, and that they always follow that there is no THC in any of the products, and they have as much CBD as they're supposed to have. So it's a very good product that I can actually count on. I have no reservations in giving it to my wife.
That's me.
Knowing that it's all safe and that you'll be good with what you're taking.
Go to thevoiceofhealthradio.com, click on the banner for Jace Clinical Solutions CBD products, and enter the code Prather, Prather, to receive a 25% discount on CBD products you can trust. Are you experiencing muscle pain or tightness anywhere on your body? Try the Rapid Release Therapy Cordless Pro 3. The Cordless Pro 3 is a targeted high-speed vibration therapy device used by medical professionals to quickly relieve a wide variety of aches and pains. After years of development, the Rapid Release Therapy Cordless Pro 3 is the latest in rapid release technology. It's more powerful, quieter, and lightweight with a long battery life, and best of all, it's cordless. Safe, effective, and easy to use, this professional quality medical device has 5 built-in heads, giving you the versatility to treat small bony surfaces, such as fingers, wrists, and ankles, and powerful enough to quickly relax the tightest hips on professional athletes. Unlike the low-speed percussive devices, rapid release therapy delivers for sensitive areas like joints, neck, and ankles safely and comfortably, and provides the raw power your larger muscle groups need. Go to our website at thevoiceofhealthradio.com, click on the Rapid Release banner, and enter code Prather, Prather, for a $100 discount for the Voice of Health Radio listeners.
I was feeling so bad. I asked my family doctor just what I had. I said, doctor.
I'm Lisa Prather, and you're listening to The Voice of Health with Dr. Robert Prather of Holistic Integration, where we get to the root cause of your health issue. Well, we're talking today about holistic heart and holistic integration. And Dr. Prather, we talked about the importance of minerals, and we checked that through a hair analysis. What role does free radicals play in cardiovascular health?
Sure, and what you're talking about is antioxidants are very well known to help to prevent cardiovascular disease. That's something that everybody pretty well says, including the American Heart Association. But free radicals, the reason that they have such a big deal is they go out and damage the arteries through the body. So oxidation process is where we make energy. And if things don't go right, the oxygen molecules are very unstable, and they'll kick off an electron, and that free electron that travels through the body, travels through the blood, and causes damage, is one of the major things that occur. So being aware of that and trying to get that under control is very, very critical. Mm-hmm. And the body has a lot of different types of mechanisms to try to control that, because those free radicals actually damage the arteries. That's when the body starts to lay down plaque. That's when you start to get the fat buildup. It's because of the plaque, and that's when you get atherosclerosis, which causes damage throughout the whole system.
Okay, so free radicals is not a good thing.
Free radicals are not a good thing.
Is lowering cholesterol enough?
Well, a very interesting thing is one of the major reasons that the body increases cholesterol level is because cholesterol helps to absorb free radicals. Ah. And one of the things is when I first started out in healthcare, way back when, the normal range that was considered by most medical doctors is you could go as high as 300 on your cholesterol and be fine. And we were talking at that time that cholesterol is a major indicator of cardiovascular disease, and we were actually poo-pooed by a lot of doctors. Oh, they're being crazy.
Yeah, that's about 35 years ago.
Yeah. So it was a while ago. Mm-hmm. Then all of a sudden they came up with, that cholesterol was such a big deal and that they had cholesterol-lowering drugs. And then everybody was all concerned about cholesterol lowering. Now, the problem with that is that cholesterol is actually not the problem. So what they did is they did a big study and found that when cholesterol goes up, then cardiovascular disease increases. So it's sort of like saying that they did a study and found out that when there's more firemen, that there's more fires. So if we reduce the firemen, fire should go down. It didn't really work because our cardiovascular rate is actually still increasing. So if this was very successful on cholesterol-lowering drugs, which so many people are on, then we would have seen a dramatic difference in cardiovascular disease. So complete failure, and it's because they don't understand. Cholesterol is extremely important. And are there times to go on cholesterol-lowering drugs? If there's, extremely high, yeah, we need to get those down. We need to get those down now. But that's not going to solve the problem. The problem is underlying causes that kick off the higher cholesterol, because the cholesterol is the body's main way of protecting itself, either remaking cells because there's cellular damage, or there's low endocrine functioning because the cholesterol is the major component to make hormones, or there's free radical damage to the arterial walls, and so the body needs to put out the cholesterol to try to, it's like a fire extinguishers for the arteries. And it's the free radicals oftentimes that is underlying that, and the body's just making the cholesterol to try to control the free radicals. So you're not really getting to the root of the problem, and that's really where structure function really shines through.
Right, getting to the root.
Definite times where you need lipid-lowering medication, but you have to understand that you're trying to get then to the underlying problem to fix it, because ongoing cholesterol medication is not going to be the answer.
Okay. Well, let's talk about other treatments at Holistic Integration. Can chiropractic be helpful in cardiovascular disease?
Sure. One of the big things that we test on is the vagus nerve, because we have the cardiovagal nerve reflex that's going on, and we need to look at that because that plays a big role in many different types of cardiac conditions. We get quite a few patients with POTS disease, which is a postural orthostatic. Basically, people wind up fainting because of their heart, and we usually find the vagus nerve is involved in that, and we get excellent results along those lines. AFib can be very much a vagus nerve type of problem, and chiropractic plays a very big role on that because we do pre and post checks on that, and we see a dramatic change with the chiropractic. We see a change in blood pressure, which has actually had clinical studies that show that there was an incredible improvement, and there's absolutely a strong connection between the nervous system and the heart. The heart doesn't beat 115,000 times in a day just on its own. The nervous system is what's telling it when and how to beat. And so dealing with the nervous system is a very, very critical part of that. And getting the nervous system working right is extremely, extremely important.
Acupuncture.
Also, we see some very excellent points. One of the things is I have at times had people come in with a heart attack. When I said, don't come into me, one of the first things that we do is hit some acupuncture points, and it actually always gets the EKG to settle down. So acupuncture points have a very direct result on, one, we can have excellent results on changing arrhythmias with acupuncture. We can also have excellent results, especially with hypertension. Hypertension, very responsive to acupuncture, and something that should be looked at and utilized.
How about herbals, homeopathy?
Herbals are extremely important. We have digitalis, hawthorn, alfalfa, berberine, bilberry. All these different types of things are very well known to have a great effect on the cardiovascular system. So, as a matter of fact, there are actually quite a few of the pharmaceuticals were based on herbs. So utilizing herbs, knowing how to do that, can have a very safe and very effective means of working with the heart. And one of the things with homeopathy, you asked about that. Well, nitroglycerin.
Right.
Nitroglycerin is completely a homeopathic product. So if you are on nitroglycerin, then you are using homeopathy. And homeopathy can have an immediate effect on the heart and have some very dramatic types of effects. We use quite a few things, Cactus grandiflorus. We have Adonis. All those different types of things on a homeopathic level are absolutely wonderful to get the heart under control. So there's a huge repertoire when we're dealing with homeopathy and herbals that pharmaceuticals have not really caught up with.
Right, and when we treat the individual. We can check
find out
exactly
which ones are actually going to work and which ones aren't.
All right, when we come back, more on Holistic Heart.
Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health.
Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip featuring Natrum Naturals, goodness in a gumdrop. Kara's a functional coach here with Holistic Integration, and we're going to talk today about a product that you've developed called Collagen Boost Gummies. Can you tell us more about the importance of collagen in our body and what it does for us?
Yeah, so collagen is the main protein that is found in mammals. In the human body, it's about 25 to 30% of our protein. So it's really important for structural support. It's a component of the connective tissue, things like bones and skin, ligaments and tendons. Collagen is also found in the hair and muscles. If you think about muscles, you can also think about like our organs. So our organs are made up of collagen. The heart contains a lot of collagen. So it's really in so many different parts of our body, and it's absolutely necessary for a healthy structural support of the body.
And I was thinking too, in the aging process, what happens to that collagen?
As soon as we hit around the age of 25, our collagen production starts to decline.
It starts that early?
It starts real early, but it speeds up. So every year it gets faster and faster.
This product is marked as collagen boosting. How is this different than a traditional collagen supplement?
Regular collagen is from animals. They typically take like the skin or the hide, sometimes the hooves of animals, and they boil it down, and then you're left with this powder. A lot of the times there's heavy metal contamination in these powders just because of the processing that is required in order to get it there. This product is vegan, which means it's safe for everybody, and there's no risk of heavy metal exposure, so it's all plant-based, and it's a much more holistic solution to just taking collagen powder because it motivates your body to create its own collagen instead of taking a collagen powder.
Yeah, and that's what we're all about at Holistic Integration. Right. Just helping the body. You know, the body's the hero.
Right. Get out of the body's way and give it the nutritional components it needs to really do what it's supposed to do.
It also is eco-friendly packaging.
Yes.
Which I like. The packaging is, I'm looking at it right now, is beautiful.
Yeah. The packaging, we partnered with an eco-friendly company who helped us design a very flexible, thin, recyclable plastic. So it takes up a lot less space in a truck. You can fit thousands more in one load, so you end up using a lot less oil when you ship it. And then it's fully recyclable, and the ink and all the material is recyclable.
You can find the gummies at natrumnaturals.com and use the exclusive code Voice of Health, no spaces, Voice of Health, for 20% off orders of $75 or more. Natrum Naturals from Holistic Integration, goodness in a gumdrop. You're listening to The Voice of Health with Dr. Robert Prather of Holistic Integration, where our mission is restoring hope to our patients. Well, Dr. Prather, we're real excited about our open house this Wednesday, February 22nd at 6 p.m. And we're going to talk about heart health. And those that attend will be signed up for a free ANS test, autonomic nervous system test, and we're going to talk about that in this segment. But first of all, Dr. Prather, what is holistic heart? What do you mean by holistic heart?
Well, holistic heart, what we've got, is we're trying to approach the cardiovascular system, which is the number one killer in the world and in the United States, in a very specific type of way. But there is a tremendous amount of disease care for cardiovascular, and that's what everybody thinks about because it's a very serious condition. And most people don't really start treating that until it is a serious condition. And disease care should be only about 20% of your health care, and structure function care should be 80%. So no matter what level of cardiovascular disease you have, that should be the split of what's going on. And quite frankly, almost every person over 50 is developing cardiovascular disease. So
That's a lot of people.
yeah, so really trying to go after that in a very specific way. So we made its own division.
So why does cardiovascular issues warrant a special section of holistic integration?
Well, it's something that eventually we would like to kind of split off and have it specialized so that people know that they're getting the best care along those lines. It is such an important part of our longevity and our health that it deserves a special type of a care, a very focused type of care. And so we've made its own division within our holistic integration. And through this, we look at the structure function, and structure function is basically bringing everything back into homeostasis. Homeostasis is from balance, and homeostasis means health. So we're creating health in your cardiovascular system.
And when we talk about structure function care, that's what we do at holistic integration. Both structure affects function, function affects structure.
Right. And also integration, we know when to refer out for different types of procedures. Again, it should be about 20% of all your healthcare, and 20% of your cardiovascular overall care should be disease care. But 80%, and that's really why we're failing. We have been dealing with cardiovascular health as the number one killer forever. And we really haven't made a lot of progress. And the missing piece on that is the structure function care. With that, we could really turn this around and reduce quite significantly cardiovascular death and disability.
So the Holistic Heart Open House is this Wednesday at 6 p.m. at Holistic Integration. What will you cover in this Holistic Heart Open House?
Well, we'll cover, one, how we diagnose. What is it that we really look at? What are all the different types of aspects? What are some of the unique things that we have that other people don't, which we really do? We're very thorough on our blood test. We do screenings that aren't normally done. The biggest indication of having a heart attack is cardiac C-Reactive. And that's actually not very often done. And
that's on blood work?
That's on blood work. And it's something that cardiologists that we've worked with have just been amazed at how quickly we can take that down and how effectively. Which, when you're really talking about the disease care model, they can't do that. So the things that we can do within Holistic Heart is not things that the disease care model, even the specialist, biggest, most expensive care you could get, does not include that.
And tell us again what that blood test is.
It's a cardiac C-Reactive. It just shows up the inflammation in through the arteries.
So who would benefit from coming to this open house?
Well, quite frankly, everyone, especially anyone, males 45 and above, females 50 and above, people who have very serious cardiovascular diseases, oftentimes aren't getting the results that they could get if they were also implementing structure function care into their healthcare regimen. One of the things that we have is external counterpulsation, is that something I'll be talking about. And basically, aerobic exercise fixes almost every single problem that you could possibly have with cardiovascular disease. So if you can get the aerobic exercise up, and basically ECP is an aerobic exercise machine. It does it for you. So I'd sit there and tell people, why should I, they go, why should I do the ECP? I said, well, you don't have to. Just go out and run 5 miles a day for 7 years and you'll get the same effect. And they go, I can't walk up the stairs. And I said, well, we can lay you down and get the same benefit of 5 years of marathon training in 7 weeks. So it's something that was developed by Harvard Medical University. It's the #1 cardiovascular treatment in Japan, China, and India.
And you're talking about the external counterpulsation therapy. Right.
And you're
We
doing
do at
aerobic
Holistic
exercise
Integration.
laying down, which is great.
And this is something we provide at Holistic
This is
Integration.
something that we provide at Holistic Integration.
So we're offering at this open house a free sign up for the ANS test, which is the autonomic nervous system test. What is tested in this evaluation?
Well, what's great about the ANS test, it is a research grade test. In other words, researchers use that to evaluate the nervous system and the circulatory system and the heart function. So it can actually show up all three in a very precise type of way. And we can see things that, if you're getting evaluated even by your top cardiologist, you're not getting that information. The closest place that has that particular test is over in St. Louis, and it's at a research hospital. So it's something that's not offered here, but it is something that is extremely complete and gives a tremendous amount of information. So the closest place besides our place is in St. Louis. Mm-hmm. So we offer it here in Indianapolis.
At Holistic Integration.
At Holistic Integration. We're going to be offering it for free, which is an amazing type of thing. Mm-hmm. But it's going to give a picture on your cardiovascular health and your nervous system health like nothing else.
Mm-hmm. And how is the test done?
That's the great thing. People sit there and talk about, I hate all the tests. But it takes less than 15 minutes. And there's no invasive type of thing. It's little patches that you put on your wrist and your ankle. And you do have to stand up. You have to hold your breath, but that's about it. And lay down. So it's a very nice, non-painful type of a test. And it's actually very, very quick too.
And what is it revealing?
Well, first off, it's revealing everything that you need to know about the nervous system, which one has a big effect on your whole system. It can diagnose POTS disease, postural orthostatic issues. So it's probably the best means of actually measuring that. The vagus nerve is something that is a very critical part of all this.
Yeah, let's talk about what is the vagus nerve and why is it important to the heart?
Yeah, and the ANS test specifically measures the function of the vagus nerve and if it's off. And the vagus nerve is the nerve that controls all the functions of your heart, lungs, and digestive system. So if the vagus nerve is interfered with, which can happen, which oftentimes does, then you're going to have heart problems that can actually occur. So one of the things you want to do is, as you are looking at this whole process, is if you're having abnormal rhythms, check on your vagus nerve, see if there's actually an interference. And the way that we fix that is through the Atlas adjustment, Atlas skull. And that has a huge effect. Matter of fact, if we're testing someone and they have an abnormal vagus nerve test, first thing we do is we check on the cervical spine, specifically if there's an Atlas interference with the vagus nerve. And oftentimes as we fix that, then we actually get the vagus nerve starting to work properly.
And that Atlas, I know our listeners know, but I want to make sure to clarify, is the first vertebrae in the spine.
Atlas kind of holds up the world, holds up the skull. And we have a specialty on that in our office.
And it holds up our head.
Atlas orthogonal.
Atlas orthogonal.
Amazing type of a procedure. We actually get quite dramatic changes in the vagus nerve and in heart function, blood pressure, all those types of things. Really is very, very critical.
And you're the only board certified Atlas orthogonist in the state of Indiana, correct?
Yes, I am.
So it took extensive study, and so the Atlas orthogonal adjustment and how it helps the vagus nerve. What about the balance of the sympathetic and parasympathetic nervous system? Also,
that can make a huge difference on how the heartbeat is. So getting a normalized type of a heartbeat. Like one thing we did is we had a gentleman who had AFib. Matter of fact, we've had a ton of patients with AFib that were recommended to actually get an ablation. And he had 42 different types of incidents as we were doing the heart monitor on him. We got the Atlas set, we got the adjustment set. We also did ECP and supplements. When we rechecked him on that, then he actually showed up only 2, and they weren't as serious. So
2 episodes.
2 episodes.
So he went down from 41 episodes.
Yes, down to 2, and they weren't the same, issues. Mm-hmm. So it was a huge difference, and basically they had told him that if he didn't get an ablation, he would probably be dead within a year.
He's a young guy.
Young guy, probably wind up with a stroke, and completely cleared that up. Mm-hmm. So, and we've done that with quite a few different, he was probably one of the more severe ones. We've cleared out the atrial fib. Mm-hmm. So it's quite remarkable when you start to add structure function care into this healthcare model that we have.
So what are free radicals and why is that important for cardiovascular health?
Well, one of the biggest things that everybody's looking at is arteriosclerosis and atherosclerosis. But they sit there and they go, well, there's a belief that it's the cholesterol that is the problem. And it's actually not the cholesterol. Mm-hmm. Cholesterol is a free radical scavenger. It actually helps to clear up. So what happens is free radicals get into the bloodstream. And free radicals are free electrons that get knocked off during the oxidative process. And they go through the bloodstream and actually cause damage to the arteries. So as they cause damage to the arteries, that increases the inflammation in there. And the body tries to repair it, and it does it through several different ways. One, it lays down plaque to kind of cover the sore area, hardened areas, so that you start to get the hardening of the arteries. And then it increases the cholesterol, so the cholesterol can actually absorb the free radicals and reduce them. So the problem isn't the cholesterol that's causing the problems, or even the plaque. It's getting to the original problem, which is the free radicals. So getting those under control, which we're actually very good at, is a very important step for solving arteriosclerosis and atherosclerosis.
Interesting. And what about insulin resistance? Why is that important?
Well, insulin resistance also causes damage through the arteries and actually throughout the entire body. So insulin resistance is something that has to be looked at and actually dealt with in people. Basically, understanding you have different types of diabetes. And insulin resistance is not that you're not producing the insulin, that you should. It's just that the cell wall is actually saying, I'm not interested in the insulin helping to carry the sugar into the cell. So you start to actually get a type 2 diabetes. And as you check on the insulin resistance, that's a great indicator of future type 2 diabetes. We can get going on that, and then as we test that, then we can actually see that problem taken care of. Mm-hmm. The other thing that is great that shows up in the ANS test is left ventricular function. And the left ventricle, when that starts to fail, that's when you start to have what we call heart problems. That's when you start to get in congestive heart failure. You start to get into all sorts of heart problems that start to occur.
That's the left ventricle.
Left ventricle. And that's where people, where the cardiologists get excited is when you start to have left ventricular disease. Mm-hmm. And what's great about our means of actually, we actually show what is the power of the left ventricle, also in the
ANS. And this ANS test.
ANS test actually shows that up too.
Okay.
Which is great.
Mm-hmm. Yeah, it's a very thorough, effective test, easy to do, and it's something that we're offering free for those that attend the open house. Again, the open house is this Wednesday, February 22nd at 6 p.m. at Holistic Integration. That's 8902 North Meridian Street, Suite 101. We're going to feed you healthy food, right? If we're going to talk about the heart, we got to feed everybody healthy food.
One of the things, of course, is that we do in our office is we're able to treat congestive heart failure, which is actually unheard of. So with the ECP and supplements combination on that, we've had people who had hearts twice the size of what they should. Mm-hmm. After ECP, 7 weeks of that, the person's heart was at a normal size, which is supposed to be impossible.
Right.
So it's just amazing what that does.
Yeah. Well, thank you, Dr. Prather. And again, the open house on Holistic Heart is this Wednesday at 6 p.m. You can sign up at our website, thevoiceofhealthradio.com. We have an Eventbrite that's gone out that you can sign up that way, or call us at 317-848-8048. Holistic Integration is located at 8902 North Meridian Street on the north side of Indianapolis. just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather.